Good afternoon, everyone. I have a quick question for you. Have you ever done something so often that you don't even think about it anymore? Now imagine if that one simple thing became the hardest part of your day. That's what we'll be talking about today. Something we usually overlook, but for others, it means so much more. We are the seventh group, and today we will tackle about learners with difficulty in self-care. Let's start with the question, what is self-care? Self-care refers to a person's ability to perform everyday tasks, especially those related to taking care of their own body. These include activities like washing oneself, brushing teeth, combing hair, trimming nails, using the toilet, dressing up, eating, and drinking. These are things many of us do automatically. But for some individuals, especially those with developmental challenges, these basic tasks can be very difficult. That's why it's important that we understand self care not just as a routine, but as a skill set that needs to be learned, supported, and sometimes taught explicitly through guidance and modeling. Now let's talk about cognitive deficits, particularly intellectual disability. An intellectual disability is a type of developmental disorder. This means that it affects how a person's brain develops, especially in areas like thinking, social interaction, and doing practical tasks. People with this condition may struggle with reasoning, learning, or solving problems on their own. These difficulties often affect their daily functioning, especially with tasks like those we mentioned earlier, those basic self care routines. And to be diagnosed with an intellectual disability, a person must show deficits in both intellectual ability and adaptive functioning. That means they may not only have trouble understanding or processing information, but also applying that knowledge in real life situations, like knowing when or how to brush their teeth, dress properly, or even ask for help. So, why is this important? It is important because as future educators or simply as members of caring community, we need to recognize that not all learners develop at the same pace. Some need more patience, more structure, and more compassion to build independence in self-care. And understanding this helps us create more inclusive and supportive environment for everyone.
Good day, everyone. I'm Rikilin C. Krause, and today I'm going to discuss the identification of learners' difficulty with self care. Young children suspected to have cognitive deficits which manifest as difficulties with self care can be identified at a very young age. The traditional approach to measuring levels of severity of ID was determined through the use of intellectual tests. So, what is intellectual test? It can be referred to measure or identify the level of severity of the child's intellectual disability, in which the mild level with an IQ of 50 to 70, moderate with an IQ of 35 to 50, severe with an IQ of 20 to 35, and profound with an IQ of below 20. However, based on the definition provided by the American Psychiatric Association 2013, using measure of intelligence is only one aspect as adaptive functioning. Also needs to be assessed to identify if a child has an intellectual disability in place of IQ levels, the support needed by a person with ID used to determine the level or degree of severity of the disability. The adaptive functioning means how well a person handles common demand and how independent they are. Compared to other similar age, some examples of these are the ability to work and practice social skills. So the presence of ID or IDD is measured by direct observation, structured interviews, and standardized skills such as the AAMR Adaptive Behavior Scale of Lombard et al. 1993 in Hayward 2013 and Vineland Adaptive Behavior Skills of Sparrow et al. 2016. So some domains measured by AAMR adaptive behavior skill include personal sufficiency, community self-sufficiency, and social adjustment. On the other hand, the Vineland adaptive behavior skills cover communication, daily living skills, socialization, and lastly, motor skills. So that is all of my part.
Next is learning characteristics. Learners with self care difficulties often reach developmental milestones at a later age than their peers. This means that the child can develop, but at a slower pace than his or her peers. Having self care difficulties can also lead to poor performance, lack of focus, and etc. They may struggle with remembering and understanding consequences of actions, cognitive planning and judgment, reasoning and problem solving, and many also demonstrate positive social skills, including friendliness and sociability.
Task analysis is a behavioral approach used in education to simplify complex tasks or behaviors into smaller, manageable steps. This method is particularly beneficial for students who struggle with learning or having specific learning difficulties. So, by breaking down a task, educators provide students with a clear, sequential pathway to success and promoting better understanding and skill development. So, there are guidelines provided to follow a structured approach based on Gargiulo 2012. So, the first step would be define the target behavior or task. So, this is the initial step that is very crucial. So, the target behavior or task must be clearly and concisely defined. So, ambiguity can lead to an effective task analysis. So, for example, instead of broadly defining the task as writing an essay, a more precise definition would be writing a 5 paragraph essay on the causes of World War I, including an introduction, 3 supporting paragraphs, and a conclusion. So, the more specific the definition, the more effective the subsequent steps will be. Next would be identify the required skills. So once the target behavior is clearly defined, the next step involves identifying the skills needed to complete the task successfully. So this requires careful consideration of the cognitive, physical, and social skills involved. So, for instance, as our example is an essay, it requires skills like research skills, reading comprehension, note taking skills, writing skills, organizational skills, and grammar skills. So, by identifying these skills, it allows educators to target specific areas where the students might need extra support or instruction. Next would be identify the necessary materials. So this step focuses on the resources required to perform the task. So in an essay, as we provided our examples, so this refers to the access to the library resources or online databases, notebooks, computer, dictionary, or even textbooks. So, by ensuring that all necessary materials are readily available, minimizes potential obstacles and frustrations for the student. Fourth one would be observe an able and competent person performing the task. So, by observing a skilled individual performing the task provides valuable insights. So, this observational learning allows the educator to understand the nuances of the task, identifying potential challenges, and refining the subsequent steps in the task analysis. So, for the essay, so by observing a student who excels in essay writing can reveal strategies or their techniques that can be incorporated into the task analysis. So the last one would be list the needed steps in sequential order. So this is the core of task analysis. So the task is broken down into a series of small sequential steps. So each step should be clearly defined and easily understood by the student. So for essay, we can choose a topic. We can conduct research, take note, like create an outline, or followed by writing an introduction. Next would be supporting paragraphs or evidences. Later on would be the conclusion. So that is the list that we needed when we write an essay. So this sequential list provides a roadmap for the students, making the complex task less daunting and more achievable. So these steps should be simple enough for the student to understand and execute independently, with appropriate support and feedback from the educator. So, for the conclusion, task analysis is a powerful tool for adapting instructions to meet the needs of diverse learners. So, by following these steps, educators can create a structured and supportive learning environment that empowers students to achieve success.
Good day, everyone. Today, I'll be explaining forward chaining, backward chaining, and video-based interventions. So, forward chaining is a teaching strategy where the students learn a task step by step, beginning with the first action in the sequence. For instance, if the task is brushing teeth, the student would start by learning how to get the toothbrush and toothpaste. The teacher initially provides full assistance, such as hand over hand guidance, and then gradually reduce support by shifting to verbal prompts, then gesture, and finally independence. These methods allow the student to master one step at a time in order, eventually performing the entire task from start to finish. The second one is backward chaining. Backward chaining is the opposite of forward chaining, where the student starts learning from the final step of the task. The teacher performs all steps leading up to the last one and then let the student complete that final action. Once the students became comfortable with the last step, they gradually taught the preceding step one at a time. This method is effective because it allows students to experience immediate success and reinforcement by completing the tasks themselves at the end. And lastly is the video-based intervention. Video-based intervention involve the use of video modeling, video self-modeling, and video prompting to teach daily living skills such as brushing teeth, setting the table, or washing dishes. In video modeling, the students watches a video of someone else performing the desired task correctly and then imitates the behavior. In video self-modeling, the students are watches the video of themselves performing the task successfully, reinforcing their learning. Video prompting involves showing one step at a time in the video, allowing the student to imitate each step before moving on. These methods are especially useful because students can replay the video as needed, helping them to develop independence and confidence in completing the task.
So, in the end, it's not just about knowing what self care or cognitive deficits are. It's about being more patient, more understanding, and more human toward those who need a little extra support. Because small things for us can be big victories for them. As Helen Keller once said, alone, we can do so little. Together, we can do so much. That's it for today, and thank you so much for listening.